I'm really glad to be able to be here today to chair this, my favourite topic, communication. Many moons ago, I said we needed 4.5 years at university on communication and 6 months on clinical work. And actually, I probably am still not far off it, but maybe a combination of the two would be useful. For you who know me, my background primary care, small town veterinary surgeon, originally mixed, and finishing up with smallies and doing a lot of dentistry at the end, which was great fun. And then obviously over the last 6 years, went through council and ended up as president this year, which has been a tremendous honour to represent everybody who's here today and many others. So going on to our RCVS Workforce Action Plan, today's session is obviously on improving client interaction and communication. The background to this is from our workforce project back in November 2021, where we had a lot of discussion with many different stakeholders about what could be done. And as I'm sure you're all aware, we haven't got a magic wand to sort all the problems with the workforce, but we have got magic wands that we can highlight our magic things that do work. And we also know that it's going to come from lots of little differences as well as a few big ones. So we've been very clear that there's no one big button that we can all press to suddenly change it. So today we are talking about communication, and we've got some fantastic people with us. I'm joined by a panel of stakeholders from the profession to share their thoughts and experiences on this topic. We have Louise Cora, Teaching Associate in Veterinary Education at Nottingham Vet School, Carolyn Ray, Joint Head of Veterinary Services at the Blue Cross, and Jenny Jones, Partner at Knockholds and Head of Veterinary Client Mediation Service, as well as Rick Harris from Customer Faithful, who will be a familiar face to many of you who've been to more than one of these sessions. I'm going to ask each of the panel to introduce themselves briefly, so starting off today with Louise.
Hi everybody, my name is Louise. I'm a vet who has gone into teaching. So as Melissa said, I teach at Nottingham University. I graduated in 2012 from Nottingham as well. Did a little bit of clinical practice, so out in practice for 4 years, and then back to Nottingham University to do my PhD in small animal consultations and how we can define how well they're going. So that's, yeah, brief 5 seconds.
Okay, handing over to Caroline.
Hi, I'm Caroline Ray, and I'm Head of Veterinary Standards at Blue Cross, a role that I job share with Alison Thomas. I graduated way back in 1986, and I have been pretty much in small animal practice full time since the time I graduated. I feel I'm part of a sort of dying breed of vets who've spent their whole career actually practicing as vets, and I have moved over more to the managerial side, but I do still practice 2 days a week. And I think it's very interesting. I pick up very much on Melissa's comment about the fact that it should be 4.5 years on communication and 6 months on the actual technical aspects of being a vet. And I know that charity clients in particular often have a very bad rap, but I think I'd like to say that most of our clients are actually lovely, and I really enjoy dealing with them. And I hope I can pass some of that enthusiasm along tonight.
Thank you, Caroline. And Jenny.
Thanks, Melissa. Evening, everyone. I'm Jenny Jones. I lead the Veterinary Client Mediation Service. It's funded by the RCVS, and we, as Melissa has alluded to, pick up probably when client interactions don't go as well. We provide some independent mediation to try to de-escalate and diffuse the situation. I've been doing complaint resolution for around 12 years now. We work in some other sectors, so hopefully tonight I can bring some human healthcare experience as well to the discussion, but very much use the insight from VCMS and the near kind of 3,000 concerns a year that come through to us. Gives us a bit of a helicopter view over what you guys are dealing with at the moment. So yeah, really looking forward to the session this evening. So yeah, thank you for the invite.
Thanks, Jenny. We're also joined by Rick Harris, as I said just before, founder of Customer Faithful, a research consultancy, who some of you might have met during a series of insight sessions ahead of the RCVS Workforce Summit back in 2021. Before we dive into the discussion piece, I will hand over to Rick, who'll talk through how the voice of the profession fed into the Workforce Summit and subsequent action plan.
Thanks, Melissa, and good evening, everybody. Yes, my name is Rick Harris, and I was in charge of bringing in the insight from the many sessions that we ran way back in the tail end of 2021. Just want to spend a few minutes trying to put the voice of the profession into the beginning of this workshop tonight. Actually hear some actual quotes of what they said on these topics, and certainly lots of comments about client interaction. We ran a number of focus groups. This is going back, as I say, to the end of 2021, which we had a fantastic response to from right across the country, which was wonderful. We got hundreds of insights from everyone from who just started to people who'd already retired, and pretty much everybody in between. Did some one-to-ones with those folk as well. Great to be able to run that independently so that they really could say what they felt. From all of those hundreds of insights that we captured and are tucked away in a database, that was the input to the workshop summit, which is November 2021, which was great to be able to share those insights and design the sessions around them with a wider group of stakeholders from government to academic and all sorts. And it was a very positive session because it was set up in a design thinking approach. For those of you who have attended some of the design thinking sessions we've run over the last 18 months or so, really focus on a positive mindset of how might we tackle some of these issues. So it sets us up for how can we do something rather than just focus on how frustrating it all is, and it's been going on for a long time. And I've heard a bit of people referencing that tonight. So on that positive note, it was great to be able to move some of those issues and ideas forward. And that was the input. The outputs from that session was the input for the action plan that you are working with today. And that, again, added even more stakeholders to the pie, as it were, and integrated with lots of other initiatives that were already going on within the college. And really important to make that a sort of cohesive set. And trying to align some of the ambitions of those initiatives with what was coming out of the Workforce Summit activity. So that's the sort of building blocks of where we've got to tonight. And if we think about those, the outputs of the summit, that middle stage 2, there were 6 themes that came out of that. And there they are on the screen. And you can see client interactions loud and proud in the middle of those, along with a number of others. And I'm pleased to say that from those 6 themes, the 7 ambitions that you've all been working with over the last months, I suppose now, map pretty closely to those themes. There really has been a concerted attempt to focus on absolutely what people were saying in those sessions. And there's a good deal of overlap, as you would expect. They're not sort of standalone themes and we take them one by one. We've been trying to do a bit of that in these sessions, but inevitably and quite rightly they do overlap, and that's the cohesiveness program that you're trying to get to. I always try to add one more slide in this little warm-up session that I hope will absolutely bring alive the voice of the profession and also give you a bit of a springboard into tonight's discussion. And so this is the slide that I've put together that I hope does that for tonight. I've taken it, actually, it's the first time I've done this for these sessions, taken it almost directly from the Workforce Summit itself, because I think that really did sum up some of the challenges. In particular, these 2. One was highly sort of mentioned, that there is a kind of under-recognized importance in the formal academic side, the schools and universities, in being able to prepare their students at that time for dealing with the kind of psychological pressures, not just the sort of, I suppose, the human pressures, but how it impacts them when they encounter stuff that they perhaps cannot cope with. And that immediately makes us think about different stakeholders here. Obviously, the client is crucial. How do employees cope with that? How do their managers cope with that? How do a regulator cope with that? And so there's lots of stakeholders that fall out of that. But that was certainly one aspect that was really loudly mentioned. And we actually had a challenge in that workshop summit, which says, well, how might we embed some processes or some kind of setup, something perhaps reasonably formal, that could develop some of those skills needed to not only achieve successful client interaction, but something that's sustainable for the employee themselves. And a few quotes that run off the back of that. I've put a few quotes up here. Some of the things that were said to me in the focus groups, it's the soft skills that keep you grounded and happy, the ability to lean over the farm gate. We're not perhaps giving ourselves as much time in the practice to develop these for new graduates. A couple of other comments. I talked at Harper Adams at the bottom there. They do a lot with comm skills with actors and so on. Really good model. I thought it was really innovative and creative, and great to see that. I've seen that in other industries work very well. And another one from a more managerial point of view, it's the job of the practice owners to manage staff in coping and behaving with difficult clients, I guess all clients, to make their lives reasonable and even take clients away from them that they weren't ready for. And that's quite a hands-on thing to achieve that in a very busy practice where you've got an awful lot of clients, especially since COVID. So that was one side of the discussion. By no means these are the only two, but these are two I just thought would be helpful for tonight. And the second one was that it's getting harder to learn this skill, and I think it is a skill of client interaction in a sustainable way. And the 3 points that are speaking to that sustainable bit was, one, partners traditionally took quite a hands-on role, they said, in dealing with this, but such are the caseloads, that's becoming harder and harder to schedule that time. A second point was made that perhaps the CD role, the clinical director role in corporate practice, was at least perceived by those in the groups, fairly or unfairly, as being less able to teach that than the traditional partners, that have been many years in practice. And the third point was that clients are getting harder to deal with, they're more demanding, and that they wear the vets down before they've been around it long enough to cope. And I think that's the wider world. That's not just our industry, that's many other sectors that are creating more demanding customers or clients. So there was a challenge that the workshop summit worked on in that, which was how can we make the skills that are needed seen as something valuable enough that an employer, whether it's an independent practice or a corporate, would want to spend the time. It's valuable, it has a commercial return to do that, as well as, of course, for the well-being of the employee and to satisfy the client. And some of the quotes that spoke to that challenge were things like that client expectations have risen so much, buoyed by Dr. Google, and the growth of the specialists, and you know more about that than I do, that road is set. That the suggestion was we're not going back on that. So they don't perhaps want a discussion, they just want a result. Faced with the fact that we're not magicians, we can only do what's possible. Another comment that I thought was really interesting was, as a well-trained vet who has these great skills is worth their weight in gold. Why wouldn't every practice want one? As much as anything that it can avoid, I think someone just said earlier on 3,000 complaints or how many it was, that can drag on, it can cost time and money, it's an investment. So there is a real commercial benefit there. And then the human side, which was a quote that really did strike me when I heard this. I remember it still. Your training prepares you clinically, but not the client side of the profession, from talking to distressed people on the phone to the moral issues of client financial constraints. They can't afford what we want to do. At 2 a.m. when clients are desperate, you want to be empathetic. No one prepares you for that. And that's the human side of it. And we heard so many people talk about the stress of how do I deal with that and how do I respond to that in a way which I feel comfortable with. So I hope just those two elements, of which there are many more, will inspire you tonight to build that into your discussion and hopefully make progress with this ambition. I'll hand you back on with that to Melissa. Thank you.
Thank you, Rick. And yeah, a lot to think about there. Many topics in just a few minutes. Thank you. Right, well, now move on to the actual discussion piece and hear from our panelists. And Louise, do you want to kick us off?
Hello, everybody. So the difficult job of going first. I have no idea what anybody else is going to say. So yeah, hopefully this matches what other people are going to say too. But like I said in the introduction, I graduated from Nottingham in 2012, and the difference at that time with Nottingham was the curriculum. It looked a little bit different to the other vet schools when I went there. Communication skills and practical skills from day one were prioritised, and I feel really lucky to have gone there. Now, obviously, the other vet schools have now started to adopt the same sort of teaching in their model, and that's fantastic to see that those skills are being integrated from the start. Once I graduated, I didn't ever want to go back to university. I was done with exams, and I joined a corporate to do a new graduate scheme. Did my 2 years and started, thinking, oh, there must be more to life than this. So I did a rotating internship at one of the university hospitals. And at the end of that, I actually joined a charity practice and did some time there. And I was hunting, really trying to hone my clinical skills and trying to find out what my niche was, what was going to make me happy. And it was whilst I was working in the charity practice, I realized that the best bit of my job, the most rewarding bit of being a vet for me, was supporting the clients, understanding their relationship with their animals, and being that person who could make a really horrible time for somebody just a little bit less horrible by doing a good job. And that's what gave me job satisfaction. So, in terms of those euthanasia consults, they're awful. They really are. But if I could do a good job, if I could communicate well, if I could be empathetic, then that's what made me not happy, but certainly gave me job satisfaction and feel like I was being a good vet. And so I sort of realized that all of this is nothing to do with my clinical ability, although obviously there are some important technical aspects that you need to be good at. But it was all the communication, the non-clinical, the non-technical skills. So I was looking for what I was going to do at that point, and I was really lucky. I found a PhD at Nottingham, and that was with Liz Mossop, Rachel Dean, Kate Cobb, supported by the Centre for Evidence-Based Veterinary Medicine, and also part funded, sort of match funded between OnSwitch and the University of Nottingham. So that really opened up my world. I was very naive before I went into that. And I wasn't just learning about communication, but actually started delving into human behavior, human psychology, and how that sort of matches up with evidence-based veterinary medicine, and why it's important to sort of take a wider view of things. I was quite, I think, as a lot of vets can be, quite quantitative, so very sort of scientific in terms of my research. I expected, laboratories and numbers and statistics and things, and actually, before I did my PhD, I hadn't really reflected on the value of understanding sort of lived experience. And through the process, obviously, really fortunate to understand that actually in life you need a little bit of both. You need the numbers and the statistics to understand what's, and then actually some experience to understand the whys and try and delve down a little bit more into things. So what I found from my PhD is probably really helpful to tell you guys that at this point. So I found that clients, generally veterinary clients, are very satisfied with their consultations, but actually the vets were a lot less satisfied with consults. So there is a mismatch there from what vets are experiencing and what the clients are experiencing. Clients generally really highly trusted their vets. They were overwhelmingly positive and trusting of their veterinary surgeon, but interestingly, the vets felt that the clients didn't trust them. So again, another mismatch there, that perception that we're not trusted in that consult room by our clients. Certainly, the consults I investigated, the clients I spoke to, do highly trust us as a profession. In terms of other things that were a little bit different between vets and clients, vets talk very much in terms of diagnosis. So the vets I spoke to always wanted to talk about the diagnostic options, the blood tests, the x-rays, etc., etc. Clients actually talk about things in a totally different way, which was eye-opening for me. So clients talk in terms of plans. They'd love you to fix it. They'd love a diagnosis, but the reality is actually they've come to you because they want to work out what to do next. And I think sometimes just understanding that what a client is hoping for is a plan and a step forward rather than a fix everything can be a really useful thing, just to sort of ground you in what clients want. Other key things I found, it all comes down to the decisions in a consultation, how we communicate things and how we take the client on the journey to reach a sensible contextualized decision for that client and that pet. Other things that are sort of relevant here, I'm trying to keep it short to 5 minutes for everybody, things around the changing role of the vet. So historically, I think as a profession, we were the knowledge keepers. We went to vet school and we learned the stuff. And clients came to us because they needed access to that knowledge. And that is not the world we live in anymore, actually. And so in terms of what is the role of the vet in this sort of modern day and age, actually, we're moving from paternalist and knowledge keeper to actually being a knowledge guide and a decision supporter for the client. Obviously, all of that comes with the caveat that as veterinary surgeons, animal welfare needs to be our #1 priority. But as long as animal welfare is being maintained or improved, then actually our job now is not to tell them what to do, it's to understand their situation and help them make the right decision. So why does any of this matter? I am wrapping up, guys. I don't know how long I've been talking, but basically because as vets, most of us, anybody you ask, any vet you ask, why did they go into it? It's because they loved animals. They wanted to help animals. Some people wanted to help people too, and that's, you know, obviously a really important part of the job. But we're striving for optimal outcomes for the patient, and that could be a cure, it could be management, it could be euthanasia in some situations, but we feel as vets we're doing a good job, and then we get job satisfaction. So hopefully this, you know, means happier vets. From a client perspective, in order for us as vets to achieve these patient outcomes, we need to work with our clients. Clients aren't the enemy. And they're also not just the person at the end of the lead or the person lugging in that massive cat basket. They're human beings, and they have experiences and they have beliefs and they have values and they love their pet. So by bringing them to the vet, they've already demonstrated how much they care. And also by Googling this Dr. Google thing, it's easy for us to feel affronted and perhaps threatened by that, but they're actually demonstrating how much they care and they love their pet when they come in with their reams of research articles. And I think it's really important for us as vets. I'm not saying it's easy, but we need to understand a person's context. Client expectations and their needs have changed, but I think really would help the profession if we remembered that ultimately we want the same thing. We want their pet to get better or to be managed or to have a painless, a good death, whatever, you know, situation we're in. And ultimately what clients want is to feel like we care about them and we care about their pet. If we do that, they trust us. If they trust us, they become engaged. And if they are engaged and they feel like they helped, you know, came to a joint decision, actually that planning process, they're more likely, the research shows they're more likely to adhere to the recommendations we're making as veterinary surgeons. Therefore, so they're more likely to book that dental. They're also more likely to administer the medication you've prescribed because they're on board with that decision making. And if you've communicated well, they're more likely to understand and remember what you've said. They're less likely to complain, and you are also less likely to make a mistake. So in a nutshell, hopefully I have convinced you all that clients are not the enemy. They love their pet, they want the best for their pet. So do we as veterinary surgeons, and it's how we can remember that on a busy day where we're tight for time and feeling like everybody is against us. Ultimately, they want to plan, they want to know we care. Hopefully that's 5 to 7 minutes.
You've done brilliant, Louise. You've fitted an awful lot in. And what I really loved there was the new role of the vet being a knowledge guide. I think that was the key statement for me. Although there's in the chat there's been a couple of other things as well. But what I'm interested in, and what a lot of people I hear, they're not necessarily correct, is that, well, we're choosing the wrong people to go into vet school. We're hearing that. But how do we get the 17-year-old who is only just starting to learn to communicate when they're applying to university? How do we get the best out of them to make sure we are choosing the right people? So by the time they're 23, 24 and very different people, we can get them out and not frightened away?
I mean, that is the $64,000 question right there. I think from my perspective, it's about setting expectations and understanding ourselves to better understand other human beings, if that makes sense. So communication is something that can be learned. There are, the research shows that we can learn to be better at it. Now, there are some people who feel more comfortable with standing and talking to people, and there are some people who it quite frankly makes them feel distinctly uncomfortable. But everybody from the all range can improve with the training. So I think it's really important that there is training. I think other things to consider would be understanding that veterinary clients are just human beings. I think it can be very easy to think, oh, well, they're clients, but actually these are the same people that access GP services. What can we learn from healthcare? They are the same people who go to garages and optometrists and all of these different things that they're service users to a certain extent. So there was actually an awful lot of research out there that's not that specific that we can learn from, the psychological research and things like that. Other things would be to just to really examine our own personal biases. What do we think clients are like? Are all farmers old grumpy men? Are all horse owners, they've got long hair and they wear a gilet and that sort of thing? Actually trying to examine our own assumptions and trying to leave them at the door, I think, is going to be key in sort of bringing the students along on the journey. Because if we can sort of say, oh, well, actually, let's go into this with an open mind, they are here with me on a journey, I'm there to help them, then I would hope that once we've taught them the sort of the logistical toolkit, then actually they find that process easier and easier, if that makes sense. I hope that's answered your question.
yeah, definitely. And I'm just on a similar line. I'm very aware that the hospitality industry, and their training, you have to, if you're a waiter or a waitress in a busy restaurant, the food has to be good. It's a bit like you assume your cat spay is going to be done professionally, but what makes the experience better is how you interact with your waiter and that. So can we learn anything from the hospitality industry, for instance?
Yeah, I think almost definitely. People are people, we're probably the most fascinating animal, to be honest, in terms of behavior. But yeah, I think we can learn an awful lot from things like hospitality. And to be honest, if a student, a 17-year-old was applying and they'd done work experience, they'd worked as a veterinary receptionist, or they had a job in a bar, or they had that time interacting with people. I mean, that certainly for me personally would go down very well. I would imagine they would use a lot of skills, and it's getting people to reflect on things more broadly outside of the consult room. What can we learn from that?
Thank you very much. I'll let you grab your breath back. Yeah, well done. And I'll hand over to Caroline, please.
I feel that Louise is a very hard act to follow, and I've almost got to the stage where I feel almost like I have nothing more to say. I mean, one of the things that I do think is that if, as a profession, we can harness our collective enthusiasm for dealing with client interactions and making them positive and enjoyable, it's something that can make a massive contribution to retention and recruitment. So I think just making sure that we try and make sure that client interactions are something that we have a positive culture around, and we're thinking that this is actually a real opportunity to help someone. Then I think that's something that could inspire the next generation of vets. And I also echo your comments about looking very favourably on people who've worked in bars and things, actually, for recruitment. I tend to feel that nothing can ever be as bad as working in a bar on a Saturday night. So, I think I have a very positive attitude to them. I thought I'd talk about something which I think all of us could probably talk about at some length, and that's the common communication challenges that we have when we're interacting with clients. And it's interesting, isn't it, even when you start to think about the most basic things, that even the choice of words we use when we're talking is very closed to a client. It's something that we really have to work on as a profession, I think, using plain English and avoiding long medical terminology and making sure that we aren't just talking about jargon. But I think the other thing is that remembering that actually our approach to clients involves the whole hospital team. It's not all about the vet. You know, a warm welcome from a receptionist goes a long way towards building rapport and getting half of your job done. And then there's that old thing about body language, and that how you say something is actually just as important, if not more important, than what you say. And one of my top tips, for better or for worse, would be that if you can be relaxed when you welcome the client into the consulting room, it helps to relax them. And you know, as I say, we want to remember that we were once upon a time, we were all of us clients, unless we happen to come from a family where, you know, everybody in the family is a vet. So again, I'd echo Louise's comments about trying not to view them as as the enemy, and to try and avoid creating a kind of them and us culture. I think that's so often so tempting, because it's, you know, for you know, in a small practice, it can be very cohesive for the team if we view the clients as being them, and then there's us who are the, you know, working together as a cohesive team. Shared decision making, I think, is a concept that we talk about an awful lot, but it can also be very hard to maintain a proper dialogue within the context of a consulting room. You know, you have to give your client opportunities to speak, and I think some of the most valuable things that I've ever heard was that, you know, you should let the client speak uninterruptedly for the first minute and a half when they first walk into the consulting room, because I think somebody quoted a statistic that it's usually just a matter of seconds before the vet leaps in and interrupts. But actually letting them get it all off their chest to start with can be a very useful tool in terms of it. You know, you find out exactly what you're dealing with, and then after that, they're usually much more prepared to listen to you. And I think, again, as Louise made reference to, you want to really try and understand not only the animal's medical problem, but also its situation and the owner's situation. So, you know, it's with things like, you know, if chasing around the cat around the house twice a day to give it medication is going to make everybody's lives a misery, then we need to look at other options. If you're going to do a cruciate repair on a rotti that lives up 3 flights of stairs, then resting it post cruciate could be a problem. And then you've got to think about the situation where you've got a big arthritic dog, and then the owner is a little old lady. What's going to happen if that dog goes out for a wee one night and then it suddenly collapses in the back garden and can't get up again? So I think the more we can understand our clients, the more we can truly work with them and guide them towards the best options. We talk a lot about how clients are becoming more demanding, but maybe we should also consider about whether we have any role in setting high expectations for the owner. And I think there may be an element of truth in the fact that, you know, we're often very focused on the diagnostics, but what the owner really needs is the prognosis and, as Louise so rightly said, the treatment plan. But one of the things that we have to watch is that the more we do diagnostic after diagnostic after diagnostic, we're starting to raise the ante and to set an idea that there might actually be a cure for the animal's conditions rather than a management plan. So I think we need to be very aware of, you know, of what we're doing when we do diagnosis after diagnosis. We also, I think, as a profession, just need to bear in mind, I think we're very aware of the way that the pandemic has affected us, but we're also a bit apt to forget that the pandemic has also affected our owners as well, particularly now with the cost of living crisis coming on top of it. But it does mean that people have become isolated, people's mental health has suffered, and their animals have become ever more and more important to them. And so, you know, it can be difficult. I mean, certainly it's something I still struggle with, when you suddenly find that, you know, the animal is 15 years old and collapsed and moribund in front of you, and the owner stares at you in disbelief when you kind of say, well, you know, they're getting towards the end of their life, aren't they? But I think there are many owners who are realistic about this kind of decision. And I think, you know, part of our role, we need to kind of lose our nervousness about offering owners guidance. You know, sometimes making difficult decisions like euthanasia, it's very hard for an owner to ask for euthanasia, but I think it's something that we should use our common sense about offering. And we also, it's good to remember that sometimes the order in which you offer options can have a massive influence. You know, if you've got the very skinny old animal in front of you that hasn't eaten for a week, then starting by talking about euthanasia rather than going down the diagnostics road first can sometimes help that client to come to a decision without feeling like they are a bad person. I mean, of course they have to be offered the other options, and of course we also have to remember to give them time to consider those other options, but just the order of options can help to set their kind of realistic expectations. Sometimes you do hit situations where, despite your best intentions and best efforts, and things are just going to go wrong. And to give you an example, I recently had a cat come into my consulting room which had got 2 badly deformed back legs. And obviously the owner had acquired it as a kitten, they looked after it, they loved it. The only problem was that as the cat was getting bigger, it was starting to get more active and those legs were getting sore. The owner's initial question was about whether we could amputate one or both legs, and we moved on from there, and we started to talk about the possibility of prosthetics. And it eventually transpired that the owner was completely unable to afford prosthetics, and they wouldn't accept that the prospect of putting the cat to sleep instead. And I can understand that, because obviously it was a very young cat, and it was something that they'd been very intimately involved in nursing. But I phoned up one of the senior family members to talk more about the options for euthanasia, and her attitude from the absolute outset was, euthanasia is not an option, and so that kind of brings you up against a brick wall, and so we just had to carry on talking. And eventually I suddenly, to my astonishment, heard her asking me, I think then that people who are disabled should be denied treatment on the NHS. And I thought, gosh, this is, it's not a question I can answer and not a question I'm prepared to discuss. So I didn't really say anything to it. I simply went straight back to talking about the animal. But sometimes you just hit that situation, despite, it's out of your control. I guess we could ask ourselves about whether the fact that at every touch point with that cat, the question of euthanasia had been discussed. And I wonder whether we had set ourselves up so that the client was building up opposition and was, had become defensive. So maybe we could have handled that situation better. But, it's just interesting that to reflect that it's not always within your control. I just want to share 1 or 2 experiences where I think my non-clinical skills were probably a lot more important than my clinical skills. I mean, and it's a situation where I really feel for new graduates, because it's one situation when you've been in the profession as long as I have, to be able to look at animals and think, oh gosh, this really isn't going anywhere. I had a cat with severe breathing difficulties brought in one Saturday when I was on duty on my own, which is always pretty exciting for me because I only work as a vet 2 days a week. It had previously had its chest drained, and then it had been out of the hospital, and then it come back in and been hospitalized and been on oxygen and everything. And now it was lying in front of me with its mouth open, breathing. And so I started the conversation by saying to the owner, what do you think is right for us to do in this situation? And she burst into tears, but she was clearly very relieved and said, I think, it's time for us to let her go. Now, I'm probably quite sure, I'm quite sure probably something could have been done for that cat to relieve its immediate distress. But, just looking at it, it was 15 years old, it was losing weight, it was clearly in a lot of distress and had been in and out of distress. It gave me the confidence to be able to offer euthanasia as an option. And, I think that's something that we should feel confident to do. I think I've probably rambled on enough without coming to a nice, neat conclusion like Louise did. So I'll close the discussion there and leave it at that.
Yeah, thanks, Caroline. I mean, but you've done well. You've given us 2 very different stories about how you can go along this communication, and actually having a period of reflection, especially with the cat with the bad legs. Did we lead ourselves up to this failure? And the failure is a strong word, but setting yourselves up for the confrontation. One question I've got, there's a few of us on this call of a certain era where continuity of care was quite normal, and so over the years we had stayed in the same practice, and we had a relationship with the client, with the family, so that literally over the last few years you were building up to the point where euthanasia might be right. And I'm using that because that's quite often where the problems are. But when I look at my nieces and nephews who are in their early 20s, their normal is not seeing the same person, be it for a doctor or whatever. And therefore, do we need to be really aware of how to have continuity of care, but with different people and different forms of communication that way? Do you do anything in your day job that way?
I think it's very helpful. And I was the head vet at one of our hospitals for many, many years, and there are still clients there who recognise me, and I certainly find it very helpful on a personal level. I think it's helpful to the veterinary profession as well, because you've got a much better grasp of that client and patient when they first come in. But I think you can overcome it by working hard to create a good rapport with the client from the outset, because I think, I've seen with, the cat I was just instancing, I'd never seen before in my life. And, I think just creating a rapport with the owner and being relaxed, open and honest is something that you can do. And my colleagues seem to have a great deal of success in doing that as well.
Yeah. Yeah, many people I've seen it in the chat here and various other comments over the past few months about, communication is such a soft skill, but to me, as I think you can understand, I feel it's essential. So how can we you have any ideas how we can make people feel it's valuable CPD as opposed to going to learn to do a TPLO or whatever they do on cruciates these days?
I think by sharing that enthusiasm that Louise clearly felt, and it is something that is just such a real aid. You can go home and feel that you have really helped a client and their animal, even though actually you may not have a clue what is wrong with the animal. All you may have done is given it pain relief or something like that. But you do have a very valuable opportunity to support people, and I think that's just as valuable a role as helping the animals. And I think we have to build a respect for that.
Yeah, definitely. So no, thank you very much. Okay, so I shall let you off the hook and hand you over to Jenny, who is our official cleaner in her official role. She cleans up our messes. So over to you, Jenny.
Thank you, Melissa. I have the marigolds at the ready over here. But do you know what's really I think encouraging and so positive from just hearing both Louise and Caroline sharing their reflections on this topic is that it is that collaborative approach to client interaction. That's what you hear loud and clear from the reflections they've both shared. And there is a perception at the moment, our stats at VCMS illustrate this, that there are more complaints, there are more situations when the client interaction becomes a negative experience for both the practice team and also for the client. And how we can focus going forward on it being a positive element of the role for everyone in the team, for the veterinary surgeon, the nursing team, front of house, the reception team, the whole team, for the reasons that I think Caroline kind of mentioned there about the welcome and the interaction, that it's such a fundamental part of the interaction, that it's a positive, it's a collaborative, both the decision making that Louise alluded to there, through to actually then, how we follow through, how we get the clients to engage in the treatment pathway or make those really difficult decisions, how actually we maintain the trust and recognizing one another as humans, because I think that definitely comes through in the complaints we see, the polarization of the vet didn't care, it's all about the money, through to then the vet saying to us, I've put my heart and soul into this particular situation and with this particular owner and animal, and the client hasn't seen that at all. And anything we can do to bring together that shared mutual goal that both have in that scenario of actually, how do we help this animal, help this owner, and for the vet to feel at the end of it that it has been that's been a positive experience, because we know the impact that it has on certainly retention. I think the observation that I would have on this collaborative theme is very much around the culture and the practice approach, the leadership within the practice, but that if we see that interaction as being something that everyone in the team is involved in, then we build that collaborative approach to how do we deal with situations that are difficult, scenarios where the owner is going to struggle, but perhaps then as a team we are going to struggle to interact then with that client. Anything, I think, that resets it back to communication between human beings to then work together to solve a problem is absolutely fundamental in us making this part of a positive and forward-looking process, I think, as well. I think the pandemic had a huge impact in all the work we had done to bring together owners, clients and practice teams, you know, making our waiting areas more inviting, sharing information, getting clients to start to open up, share their worries, share their concerns with us. Suddenly, you know, we were forced to then separate and stop all of that. What I think as we come out of that, we've had the cost of living crisis, which brings its, you know, the fundamental challenge of affordability and the impact that has on decision making. We really need to look at how we reset and see the positive in that client community interaction, that connection that we make in the consult room, in the waiting room, when they go home, when they do go onto Google and they're looking for information. How do we build this as being very much a joint project? It's not a them and us, actually. It's about understanding the clients, you know, echoing the comments that have already been made. What is it that this client needs from the interaction? And that has to be part of the overall decision-making process. We talk, when we look at using mediation to resolve conflict and disputes, we talk about an iceberg, and there's the element that we see above the surface. So what the client has said, what we can see from the animal, you know, what the diagnostic tests are telling us. But then we have all the issues that sit below the surface. And in an interaction with a client, our effective communication is trying to lift all of those issues above the surface, so we air them. So Caroline's point about, you know, actually, do we have to navigate 3 flights of stairs with a, you know, a particularly heavy animal? Are we looking at somebody who would really struggle with long-term diabetes care for their animal? We have to look at the wider picture, the holistic situation, and that's where that lived experience that we've heard of this evening, working in a bar, actually being able to engage the owner in asking questions but also sharing information. We don't have a huge amount of time to do that. I get that in a consult, but actually how we use, you know, open questions, silence. One of the best bit of advice I was ever given was, you know, we have 2 ears, 1 mouth. Using them in those proportions is really, really valuable in communication. Communication, when we're looking at, you know, what are we trying to achieve? Yes, it's the sharing of information, but it's the understanding of that information, and it's then also applying that information. And, you know, to move away from a tick box of, well, I have told the client X and Y. That's the end of my job. It's not. We need to then look at how do we make sure that we have the skills to be able to check in with the client, make sure then that we've given them the right information, they've understood that information, and that we're then applying that information together to be able to make really good decisions, because that joint collaborative decision making does help. It helps with the buy-in, it helps with compliance, it also absolutely helps with accepting the outcome, because part of communication is also that we can't control the outcome. It would be lovely if we had A plus B equals C, but particularly in veterinary, and we see this in human healthcare, but more so I think in veterinary, you know, you have owners who are there on behalf of, they are representing their animals, their loved members of the family. They don't have their own voice, therefore owners feel very much in the position of the advocate. You know, often I need this for my animal, I need justice for them, is what we hear when things go really wrong. And actually how we can ensure that when we are working to help them make those right decisions, we're engaged in what's got to be, I think, that two-way trust. We have to feel that clients trust us as professionals, and then the owner has to feel that they're trusted to have their, their values, their beliefs, and as Louise mentioned, actually also to be brought into the decision-making process. And yes, we are seeing at the moment some unacceptable behaviours out there. Rick alluded to this, I think, in his intro. That is not unique to veterinary. I ran a session last week with an NHS team, and we know that as a society we are reacting differently, and certain individuals within society are reacting in a way that is on occasions unacceptable. When we're looking to manage that, again, looking at why people are acting in that way, thinking how can we stand in their shoes to understand, is it a particular vulnerability? Has there been a trigger for that behaviour? We do need boundaries, absolutely, but often when we're mediating with a practice, they will say this client has been really aggressive and really confrontational, but actually when we then start to delve into that, it is a coping strategy within that particular scenario, and we do jump to conclusions. I think one of the delegates asked, is there a stigma around certain client groups? And I think it's our discomfort in how do we handle this situation. So I think when we are looking at communication skills, yes, it's very much about honing our own skills, but also our ability to adapt those skills, to flex and approach situations in a slightly different way, depending on the client, the situation, etc., that presents themselves, because we can't give a script. This is very much about learning your way of dealing with these situations and honing those to then feel confident and comfortable. And I think has been mentioned tonight of mentoring and actually how we bring on the next generation. The best way of doing that is often seeing somebody else having those tricky conversations, the time when we could be in the same room and we could overhear that. And I think we do look to sometimes protect those coming into the profession. That's going to be a difficult situation. We'll keep them out of it. And I think that was one of the reflections from the focus group. But we do need to enable them to develop their skills to handle those scenarios as well. And I think as we move forward, preparedness, and also then learning together, those that have got the t-shirt, done the jigsaw, and those that are starting to put that on for the first time, absolutely working together to learn from one another. But it's seeing it in action, because there isn't a golden bullet and a quick panacea. So I think really positive that we continue to talk about the interaction as a positive engagement and a relationship that is based on trust and the ability to share information and guide one another. As I'm not a vet, obviously I'm not a veterinary professional, but you need to understand from the client and that animal owner what's going on in that situation, and then the animal owner needs the guidance, the expertise, and the clinical judgment of the veterinary professional and their team to bring that all together and for it to be a collaboration. So supporting that absolutely has to give us a real, I think, a positive stance on client interaction.
Thanks, Jenny. An awful lot in there to take away. I think one of the key ones was matching expectations for the client and yourselves. One thing I often struggled with was I thought I had explained everything well, and the owner seemed to leave the consult room agreeing with everything and understanding it, and they actually didn't have a clue. And I was fortunate that it was back before the social media keyboard warriors got into their full swing, which they do now. And I generally feel that this is a big area where we think we've actually done an okay job. They've agreed with us, they've nodded, they paid their bill as they went out.
The consent form, yeah, absolutely. Yeah.
And then they go home, and so their version is spilled out in the family, and there's a totally different side of it, and that's where a lot of problems come. And also having to talk about money, it's one of the hardest things. We're told we have to inform people, but yet then we come over as that's all we care about. But it's such a complex. But one question is education and CPD. But how do we get veterinary professionals who are less engaged, because everyone who's here tonight is obviously engaged, how do we get people who are less engaged the self-realization that we need to learn this skill throughout our careers and do a little bit of navel gazing? And I hate to say, we're not very good at criticism as a profession. You know, we don't take it very well quite often. And so how would you get it over to the masses that we need to do this type of thing?
I very much feel that the evidence-based research and learning to show the commercial impact of it. We focus a lot rightly around the well-being, and that's quite an individual view then, how does dealing with a complaint about me impact on me and my mental health and the coping strategies around that. But I think when you're looking at perhaps those who don't perhaps appreciate the value of needing to invest the time, the money and the effort in this, the clinical CPD has got a waiting list and people are dashing across congresses to get to that particular session. In other sectors, they do put some requirements, a certain proportion of CPD being allocated to these essential skills. I think that isn't necessarily something I can see working particularly well in veterinary, because I think it is about understanding the value. We can't turn the clock back, that's already been said. We can't just keep talking about clients being the problem, and therefore actually building that narrative of we need to adapt, that's the species that survive, and then we'll thrive. We have to be able to adapt. I do think though, when we're looking at the clinical CPD, if we can factor into that the communication element, not just at university and new grad level, but going through ongoing CPD, we'll start to filter it in. I think those that aren't recognizing the importance of this, unfortunately, are feeling the brunt of client frustration. And I think at the moment we have a situation of supply and demand not influencing that. But I think if that were to alter, there will be practices where they will not be able to retain the good clients that they want to, because they will walk. And that's the hospitality industry is sort of prime example of that. We've alluded to that earlier, that you're not going to have happy clients. They are now very vocal about being unhappy, but I think we have to show the value in committing the time and the resource to this, as much as we do clinical quality improvement. It has to be part of our professional CPD.
Yeah, no, wise words. So that takes our 45 minutes on each specific speaker, and I'm sort of now going to go to more general topics for anyone to be able to, any of the speakers to be able to have a go on. We've got a couple in the chat, one right at the beginning, if I can get my little mouse to work, so I shall scroll up. If we have time, and I have made sure we have got time for Vicky's question up here, it would be good to discuss how to demonstrate the commercial and quality of life benefits of more effective communication and client engagement, the value of supporting it, which we've sort of touched on just in that last bit. But I think that was a really valuable point there. Does any of the speakers tonight want to add to that?
It's something won't surprise you, incredibly interested in, both veterinary and across in other sectors, because I think there's some initial research and work conducted up in Glasgow University, more in the human healthcare side, around the impact of being complained about, and starting to look at how that changes our approach to practice, so becoming more defensive, and then the implications of that, both in terms of our satisfaction, our development, but then I think also from a commercial setting, also the impact that will have in terms of the success of the practice from that side. I think there's the opportunity to do a lot more as we look now at capturing some of the data around this and starting to progress. There are Louise will have way more information on this than I will, but actually the growth, I think, in PhD study and further study around this topic, it's probably more than there's ever been. I think, Louise, would that be your thought on this?
There's a wealth of research happening across multiple universities. Obviously I know about the stuff that's happening at Nottingham. From a sort of a commercial point in terms of relationship building, there is a study that was done in the US, but they actually found that consultations that contained more psychosocial conversations, so conversations about lifestyle and sort of holidays and family life and other non-medical conversations, those consults were 1.5 minutes shorter than the ones that just focused on the biomedical conversation. So actually, from a commercial perspective, even if this isn't your bag, less likely to have a complaint made about you and actually getting through your consults a little bit faster. Hopefully even the most cynical person would agree that it is worth building that relationship.
It's funny you should say that. So I had 10-minute consults when I left clinical work, and I'd have about 3 minutes on clinical and 7 minutes catching up on the family gossip. So yeah, probably not the best way of doing it, but it worked for me. So yeah. So someone else is also asking about if we have any research insight from other professions on the impact of engagement education at the stage where the client first chooses a practice, listening for their rationale or anything like that. Does anyone know of anything, any of the panel members know of any research going on there?
I think I'll have to have a look and possibly share that after this evening's session, because I think there is some in optometry, I think, around there, because we obviously seen there that combination of retail and also healthcare coming together. So the choice question becomes more relevant and certainly is emphasized more. There's a lot of research in the NHS around choice, but obviously we don't have the cost element factored in, so that may not be quite, it might not transpose quite as well to veterinary, but I'll see what I can dig out.
That'd be really good. I don't think there's a one size fits all, because we all want different things as well. It's, we're all different personalities. And I would say one of our key moments was when, as a practice, we had some CPD for the whole practice on personality types and learning how to deal with the different personality types from us, because you can't always guarantee that the ones of the blues are going to meet the right people when they're on consults that day, and the reds are on another lot. I found that really very useful.
I would echo that in terms of certainly communication and team approaches, because it's definitely a factor, getting to know your client, and particularly if it becomes a complaint scenario, getting to know that complainant, what it is that makes them tick, what has triggered them, what's continuing to trigger them. Actually, then adjusting, talked a bit about adapting our communication style, and very much that profiling really fits there.
So I'm going to start drawing this to a close today. I'm just going to go around each of you for your key point that you'd like to send people away with remembering. Louise, I'm going to start with you.
Thanks. I think my key point is clients are not the enemy. They love their pet. It's our job to work with them to get a good outcome.
Thank you very much. Caroline.
Again, following Louise, it's so tough, isn't it? I think the key thing I would like to say is relax and enjoy your consultation, which is really a more touchy-feely way, perhaps, of saying what Louise has said. But I think, getting the enjoyment back into consulting and getting the pride in actually helping somebody, the key thing, isn't it?
Yeah. Jenny?
I would echo that, and also the reality is veterinary interactions will often involve some very challenging situations and will not always be Rosie, and I think Louise's, you know, was that passion to how can I know that at the end of that interaction I have made it the best it possibly can be. I think is great. We don't have a magic wand, and I think that realism that, you know, we will get things wrong sometimes, and, you know, we might not always get the communication right, but if we go in with the aim of, you know, trying to really, you know, do our best, understand what's going on, and make sure that we are, you know, making that collaborative decision together and working through. Yeah, I think it's really heartening to read the chat and to see the focus on positive client and practice interaction. So more of that.
Thank you. So now I definitely feel that now I'm starting to reflect on my career, that although it was the animals that drew me to the career, all the way along I've been a people person and I've wanted to be involved with people. So when I quit as a clinical vet, it was the people I missed. It wasn't the clinical work. And I think those of us who have survived in the long term in the profession is because we actually like people and like interacting with people, and to not be frightened of it. There will always be that one client that you see walking in that you will just go, oh no, I really don't want to go there. But that's the time for your big girl pants and having to sort of, that's the art of the veterinary surgeon, to be able to go in and deal with these ones just as if they were your best buddy, and keep smiling as much as you can. So I love the fact that we recognise that we're all human. I think that's been really useful in case we had forgotten it. We're human as well. Communication is definitely a two-way thing. It's hearing as well as speaking, and it has many different forms, especially in the modern era. But you're not just going to be in a consulting room with a table between you, which is also a barrier. Sometimes just move to the side of the table. That can help break things down. We don't have any absolute rules, and it's very fluid. It can change even within that 10-15 minute consult, and you've just got to be able to learn it. And it's a real skill, and everyone who goes and does a 3-hour session of consulting is one of my everyday heroes, because it is really hard work, and everyone should be really proud of themselves. And maybe when you see someone who you've maybe been on ops and you've seen someone coming out, just coming for 2 minutes in near the op room with their coffee, just give them a wee pat on the back and praise them for what they've done, because it is hard work and it's tiring, which is why when you get home we're as crabby as can be and take it out on our nearest and dearest. But it is essential for a successful career, to be honest, and should never be undervalued. So we need education, that's Louise's job. We need the CPD, the during, and Caroline's tips and everything. And then hopefully we will make Jenny redundant. I highly doubt it, because it is human beings, and human beings are human. So we're going to thank you all very much. I'm just checking my notes here so I don't forget anything. I have done summarised my key takeaways. I'm going to thank, because they won't thank themselves, the RCVS teams for organising all of these. Debs, Sophie, Anvarad, and all the team involved in all of them, because without them we wouldn't have done it. So thank you very much. Thanks to Rick and everything like that on your department. And I shall now hand over. Thank you once again, my panelists tonight. That's Louise, Caroline, and Jenny. And now I'll hand back to Deborah.
Thanks, Melissa, and thanks to the panel too for tonight. We've now come to the end of the session. We will follow up with a summary of the session, and the recording will be made available on the website. We will be sending out a short survey and would be grateful for your feedback. This is now the last in the series, and we appreciate all of your engagement. We will be reviewing all of the questions submitted across the series and hope to re-engage with another session that answers outstanding themes or any questions. Thank you again, and good night.